Hello. I am Maria from Miami Shaman. I love to share scientific information related to popular dietary supplements so that you can make an informed decision. Today, I will talk to you about saw palmetto. Saw palmetto is native to the southeastern United States and it has played a vital role in traditional medicine for centuries. Indigenous peoples, especially the Seminole tribes of Florida, recognized the berries as a powerful remedy for urinary and reproductive health long before modern medicine identified their relevance in conditions such as benign prostatic hyperplasia or BPH. The Seminole Indians also valued saw palmetto for its ability to soothe digestion, heal wounds, and boost vitality in elders. When European settlers observed these uses, they incorporated saw palmetto into their own medicinal practices. By the 19th century, it became a staple in herbal medicine, particularly for urinary and prostate care. Today, saw palmetto is celebrated globally for its natural wellness benefits, with its bioactive compounds extensively studied and validated, especially for supporting prostate health and promoting hair growth. Saw palmetto or Serenoa repens is a small, slow-growing palm native to the southeastern United States, especially Florida. This fan-shaped palm typically grows up to 2 to 3 meters in height and spreads across the ground with sprawling woody stems. Its leaves are characterized by sharp, serrated edges, often appearing as fan-shaped or palmate, and the plant produces small yellowish flowers that develop into dark purple or black berries. These berries are the primary part of the plant used for medicinal purposes. They contain a range of bioactive compounds that have been studied for their health benefits. Key constituents include fatty acids like lauric, oleic, myristic, and palmitic acids. Saw palmetto berries also contain phytosterols such as beta-sitosterol, stigmasterol and campesterol. Flavonoids like quercetin and polysaccharides. These compounds are particularly noted for their anti-inflammatory, antioxidant, and hormonal modulating properties. Let's review saw palmetto for benign prostatic hyperplasia or BPH. The most important bioactive compound in saw palmetto for managing benign prostatic hyperplasia or BPH is beta-sitosterol, a phytosterol found in high concentrations in its berries. Beta-sitosterol has been extensively studied for its ability to alleviate urinary symptoms associated with BPH. It works primarily by inhibiting the enzyme 5-alpha reductase, which reduces the conversion of testosterone into dihydrotestosterone or DHT. Elevated DHT levels are associated with prostate enlargement and hair loss. Additionally, beta-sitosterol exerts anti-inflammatory effects by modulating inflammatory pathways and reducing swelling in the prostate tissue. Scientific studies highlight its role in regulating proteins like NF-κB and COX-2, which play central roles in inflammation, and balances cell-regulating factors like BAX and BCL2. This helps mitigate inflammation and tissue enlargement associated with benign prostatic hyperplasia. How are saw palmetto berries used for BPH? Most commonly, saw palmetto berries are processed into lipid-based standardized extracts or supplements. This preparation method is highly effective because the key bioactive compounds, such as fatty acids and beta-sitosterol, are lipophilic, meaning they dissolve in fats rather than water. As a result, aqueous extracts like teas or water-based tinctures fail to extract these essential fat-soluble components, making them less effective for BPH management. Recommended dosages vary, but studies often use 160 mg of saw palmetto extract twice daily. Clinical studies supporting saw palmetto for BPH. Clinical trials and meta-analyses have shown that beta-sitosterol supplementation can improve urinary flow rate, reduce residual urine volume, and alleviate overall symptoms of BPH without significant side effects. Breu et al. Reported in 1992 that placebo-controlled, double-blind clinical studies carried out on more than 2,000 BPH patients in Germany confirmed the effectiveness of saw palmetto extract in BPH conditions. In a comprehensive 2021 review published in Euro, Dr. Stephen B. Strum analyzed 58 clinical trials spanning 40 years to evaluate the effectiveness of standardized saw palmetto extract for treating lower urinary tract symptoms linked to benign prostatic hyperplasia. The review, which incorporated studies in multiple languages, concluded that a daily 320 mg dose of lepidosterolic extract significantly improved urinary flow, reduced symptoms, and delayed the progression of BPH. Although 2 US-based placebo-controlled trials did not show significant benefits, the majority of global studies confirmed the extract's efficacy and safety. The review also pointed out that crushed saw palmetto berry powder, commonly sold in the US, is less effective than the standardized extract used in clinical trials. Furthermore, a 2020 meta-analysis by Kai et al. Reported that saw palmetto showed similar efficacy to the standard pharmaceutical tamsulosin in improving symptoms, with fewer side effects. Saw palmetto is generally well tolerated, with mild side effects like stomach discomfort reported in some cases. Multiple clinical trials, including those led by Evans et al., found no evidence of serious toxicity associated with saw palmetto use. In the Camus trial, Evans concluded that a standardized saw palmetto extract showed no signs of toxicity even at doses up to 3 times the usual clinical dose during an 18-month period. Additionally, saw palmetto does not interact with medications or affect PSA or prostate-specific antigen levels, a key marker used to monitor prostate health. Elevated PSA levels can indicate conditions like prostate cancer, BPH, or prostatitis, further supporting saw palmetto's safety profile for most users. Saw palmetto for hair loss. Scientific studies suggest that saw palmetto may support hair loss treatment, particularly for androgenetic alopecia, a common form of hair thinning caused by the hormone dihydrotestosterone or DHT. As previously mentioned, saw palmetto acts as a natural 5-alpha reductase inhibitor, reducing DHT levels, which helps prevent hair follicle shrinkage and promotes healthier hair growth. A randomized trial reported by Evren et al. Found that the use of various topical and oral saw palmetto-containing supplements resulted in a 60% improvement in overall hair quality, a 27% increase in total hair count, and enhanced hair density in 83.3% of patients. Additionally, 52% of patients experienced stabilized disease progression. Saw palmetto was well tolerated and not linked to any serious adverse events in patients with alopecia. Zhu et al. Demonstrated that lepidosterolic extracts of saw palmetto promote hair regeneration and repair in hair loss mouse models by activating the TGF-beta signaling and mitochondrial pathways. These pathways are crucial for maintaining hair follicle health, with TGF-beta involved in regulating the hair growth cycle and mitochondrial signaling enhancing cellular energy production and reducing oxidative stress, both of which are essential for supporting healthy hair growth. Topical saw palmetto is available in various forms for scalp application. These include hair oils or serums, shampoos and conditioners, and leave-in treatments such as sprays or creams. Each form is designed to allow the extract to be applied directly to the scalp, offering consistent exposure to the active ingredients for hair health. Saw palmetto is generally considered safe when used appropriately, but like any herbal supplement, it may cause mild side effects in some individuals. It is important to consult a healthcare provider before using saw palmetto. The scientific references for this information can be found in the video description below. Thank you for watching. See you next time.